So, hello everyone, welcome to Good Mental Health once again. So, I hope you all are doing fantastic in your life. That's what I always wish for. And today we are back to the episode of Disorder Dialogue series, that is 2022. So, in today's episode, I'm going to talk about mood disorder. But before I shall really start talking about mood disorder, I'm sure that many of you must be aware about this disorder. And to those who doesn't know anything about mood disorder, I'm here to explain you what is mood disorder. Also, I'm going to share its types. And moving on to, I am going to discuss about the case, and at the end I'm going to talk about the treatment or intervention, that what are the interventions, possible interventions there to treat mood disorder. So many of you, if not aware, stay tuned with me until the end of the episode, and that is going to help you get a brief about what is mood disorder. Also, if you have any queries, you can put on the comment section below, and I will reply all the queries at the end of the session. So before I'll just start with the mood disorder, I just wanted to make an announcement. It is regarding my upcoming online psychology internship. That is completely a wonderful idea to take a counseling, internship right from the comfort zone of your home. So it is a psychology internship and for more details, you can just go on to my website, that is www.goodmentalhealth.in. In that, on the top bar, you can just click the psychology internship tab, right? From there you can definitely go on and check the details about what I'm going to cover. Also, you can get to know that there are certain awards and letter of recommendation will be given to the best person, and there are a lot of activities and number of mock sessions. So what are you waiting for? Just go register soon, and the seats are going to be booked very soon. So I really would like all of you to be here there in my class. So now moving on to the topic of the day, which is mood disorder, we are going to talk about what is mood disorder. And before I shall start sharing that, let me just give you an introduction about me. I am psychologist Anuradha, who is the founder director of Good Mental Health. I'm an RCI rehabilitation psychologist, also a professional adoption counselor, an international radio show host, which is totally the show is totally psychological based, where I'm doing a lot of shows relating to the topic of psychology, right? And number of things are there. And I'm a life coach and a podcaster. So I hope you will really like this episode, which I'm going to start with, which is mood disorder. So let's begin with having a little bit of understanding first about what is mood disorder. So it is a mental health disorder, and I'll try explaining it in Hindi as well. That's what I have every time got a lot of queries that ma'am isko Hindi mein bhi kijiye. So I try my level best. So जब हम मूड डिसऑर्डर की बात करते हैं, इट सिंपली इज अ मेंटल हेल्थ कंडीशन जिसमें कि बहुत सारे मूड स्विंग्स होते हैं और दैट इम्पैक्ट द पर्सनस इमोशनल स्टेट, राइट? और इस डिसऑर्डर में एक्चुअली कोई भी पर्सन एक लॉन्ग टाइम पीरियड के लिए एक्सट्रीम ईदर हैप्पीनेस को फेस करता है, extreme sadness ko, or either it is both ways, right? So when the person is experiencing the mood swings, so there are certain things on a higher side or on a lower side. Either the person is extremely happy, extremely sad, or sometimes there's a mixture of both. ठीक है? सो ये डिसऑर्डर जो है बहुत सारे चेंजेस लाता है, इम्पैक्ट करता है एक पर्सन को, उसकी डेली रूटीन एक्टिविटीज को इम्पैक्ट करता है, उसके बिहेवियर को इम्पैक्ट करता है, थिंग्स लाइक उसके वर्क में इंटरफेयर करता है. अगर इफ यू आर अ स्टूडेंट, सो इट इंटरफेयर योर स्टडी एज वेल. So if somebody is experiencing mood disorder, so it's going to impact you badly in certain way, right? So it's really a condition in which we recommend that there should be taken a right guidance and an intervention. It is necessary because few mood disorders are very dangerous and you should seek help immediately. Moving on to the types. So these are basically when we talk about the types of mood disorder. So basic types are two. One is depression, another is bipolar. So these two have certain categories, or you can say these two also are followed by the types, right? So depression is something that already I have covered in one of my DD episode earlier. but there were a lot of types that I discussed at that time. मैंने बहुत सारे types को discuss किया था, but right now we have picked up those types of depression जिसमें कि mood disorder पाया गया, right? So then bipolar is the second type जिसमें कि 4 types होते हैं, and which is I'm going to explain in further like when we proceed. And the third category is other mood disorder जो कि प्री-मेंस्ट्रुअल या फिर एक इंटरमिटेंट एक्सप्लोसिव डिसऑर्डर होता है, एंड दिस इज व्हिच आई एम गोइंग टू एक्सप्लेन वेरी सून. So starting with depression, that is the first type of mood disorder. So depression basically कैसे जाना जाता है, it is been everyone knows that depression एक common mental disorder है जिसमें कि grief या sadness एक typical response होता है, एक ट्रॉमेटाइज्ड सिचुएशन का एक रिस्पॉन्स होता है. दैट कैन बी क्राइसिस, दैट कैन बी डेथ ऑफ समवन इन द फैमिली और योर लव्ड वंस, or there is a loss of job, or there is a major illness, right? If somebody is been really having or going or experiencing a major illness जो कि एक बहुत बड़ी बीमारी है हो गई हो, उससे भी डिप्रेशन हो जाता है. सो डिप्रेशन जो है एक मूड डिसऑर्डर है जो कि परसिस्टेंट फीलिंग्स जिसमें होती हैं किसकी, सैडनेस की, और उसमें एक्सट्रीमली आपका जो इंटरेस्ट है, यू जस्ट लूज योर इंटरेस्ट इन डूइंग एनीथिंग. हाउ विल यू गेट टू नो दैट समबडी इज डिप्रेस्ड? वो टोटली सैड रहने लगेगा इंसान, और उसका अनदर जो इम्पोर्टेंट मेजर सिम्टम होगा वो ये कि वो उसका इंटरेस्ट किसी भी चीज में खत्म हो जाएगा, ठीक है, लॉस ऑफ इंटरेस्ट. एंड ऑल्सो मेजर डिप्रेसिव डिसऑर्डर, और इसको हम मेजर डिप्रेसिव डिसऑर्डर भी कहते हैं और क्लिनिकल डिप्रेशन भी कहते हैं. So this is the first type of mood disorder. So there are certain other types in depression जिसमें कि mood disorder reflect होता है. So the number one is postpartum. So when we talk about postpartum depression, इसको पेरीपार्टम भी कहते हैं. ये बेसिकली एक इट्स अ फीमेल डिसऑर्डर जो कि इसमें एक सैडनेस होती है आफ्टर हैविंग अ बेबी, राइट? व्हेन अ वुमन इज इन हर pregnancy time, right? Since then she starts to feel depressed, and it is followed until she has delivered the baby. So this is a disorder जिसमें कि significant hormonal shifts होते हैं जिसके कारण women एक ऐसा like mood swings को experience करती है. इसका onset I told you pregnancy से start होता है, followed by जब baby हो जाता है, birth, जब एक female deliver करती है एक baby को. So postpartum depression को peripartum भी कहा जाता है, इसको baby blues भी कहते हैं. इसमें बहुत सारे मूड चेंजेस होते हैं, एंजाइटी एक्सपीरियंस की जाती है, इरिटेबिलिटी होती है, और इट स्टार्ट्स फ्रॉम द टाइम ऑफ गिविंग बर्थ, एंड इसको ये दैट स्टेज फॉर नंबर ऑफ वीक्स एज वेल, मे बी 1 week or 2 weeks, that it is followed by these number of days or couple of weeks, right? सो पोस्टपार्टम डिप्रेशन जो है उसके सिम्टम्स जो हैं समटाइम्स सिवियर होते हैं और लॉन्गर लास्टिंग भी होते हैं. सो दिस इज वन टाइप ऑफ मूड डिसऑर्डर which is the part of depression. And the other type of mood disorder which is the part of depression is persistent depressive disorder. So persistent itself explains a lot. Persistent क्या चीज होती है? जो persistently होती है, repeatedly होती है. So इसको हम डिस्थीमिया भी कहते हैं, और ये chronic depression होता है जो कि लास्ट करता है फॉर अ लॉन्गर टाइम पीरियड विच इज 2 years और समथिंग ऑफ टाइम, राइट? सो पीपल माइट एक्सपीरियंस ब्रीफ पीरियड जिसमें कि उनको बिल्कुल कोई डिप्रेशन नहीं है, दे फील दैट दे आर कॉन्स्टेंट, दे आर एब्सोल्युटली गुड, उनको कोई ऐसे सिम्टम्स नजर नहीं आएंगे, एंड दे फील दैट दे आर ऑल राइट. बट सडनली उनको, क्योंकि इट इज अ परसिस्टेंट डिप्रेसिव डिसऑर्डर, तो फिर से इन सर्टेन टाइम पीरियड आफ्टर लेट्स से कि 2-3 months के बाद दोबारा से डिप्रेशन स्टार्ट होता है, और इसको सिवियर मेजर डिप्रेसिव डिसऑर्डर भी कहते हैं, और ये अनएस्केपेबल है. अगर एक इंसान, एनी पर्सन हु इज एक्सपीरियंसिंग परसिस्टेंट डिप्रेसिव डिसऑर्डर, वो इजीली इससे एस्केप नहीं कर सकता. either the person has to seek some help or there has to be certain ways which he or she has to follow, तभी इन symptoms से वो निकल सकता है. और symptoms जो है occasionally lessen भी होते हैं in severity during this time. Sometimes वो कम हो जाते हैं, but sometimes it becomes very serious too. So this is about persistent depressive disorder. Moving on to the next one, which is seasonal depressive disorder. So when I'm talking about seasonal, ये seasonal का मतलब क्या है? जो season to season appear करता है. persistent is that there is a persistency, थोड़े टाइम के बाद फिर से वो occur होता है, seasonal occur होता है season to season, right? So ये एक another type of depression है जिसमें जो एक particular season में impact करता है किसी भी इंसान को. Typically it starts in the late autumn और early winter में होता है या फिर last करता है until spring or summer. सो लेस कॉमनली है कि जो सीजनल इफेक्टिव डिसऑर्डर है उसके एपिसोड्स जो हैं लेट स्प्रिंग में हो या लेट समर में हो. सो समटाइम्स इट इज अ विंटर डिसऑर्डर and there are cases in which people experience that they have depression in the season of spring and summer. Fine. So it is seasonal. That is why it is seasonal. So symptoms of winter seasonal affective disorder may resemble those of major depression. जो major depression के साथ इसके symptoms मैच करते हैं और इसलिए दे टेंड टू डिसअपियर या फिर वो लेसन हो जाते हैं ड्यूरिंग द स्प्रिंग एंड समर टाइम. सो सपोजिंगली एनी पर्सन हु इज एक्सपीरियंसिंग सीजनल इफेक्टिव डिसऑर्डर और जिसको विंटर में इम्पैक्ट होता हो, ये डिप्रेशन होता हो, सो उसको अदर सीजन्स में दैट पर्सन फील्स एब्सोल्युटली नॉर्मल एंड गुड. बट व्हेन इट इज द सीजन इन विच दे गेट इम्पैक्टेड, तो तब उनको वो हैवी लगता है, right? They feel more depressed, they feel more sad, they just find it difficult to do their day to day routine tasks. So that is why it is called seasonal affective disorder. ये season to season हर एक को impact करता है and everyone has a different every individual is different, इसीलिए हर एक को अलग season में भी impact कर सकता है. all the 4 seasons में से किसी को भी कोई भी season में impact कर सकता है. Moving on to the another type which is psychotic depression. ये हम severe depression मानते हैं क्योंकि ये combined है किससे, episodes of psychotic disorder, right? So when I'm saying psychotic, इसमें क्या होता है कि there are hallucinations, there are delusions. The person experience both of these things. Hallucinations जब उसको कुछ दिखाई या सुनाई दे रहा है which is not the reality. When a person is experiencing delusions, which means उसको बहुत सारे false beliefs हैं which is not even the reality, but the person's mind has been fixed to be thinking that way. उसका mindset limited हो जाता है. So कहते हैं ना limiting belief. So वो उस limiting belief में ही रह जाता है वो person and it becomes difficult कि वो कुछ और सोचे. और ये सारे जो upsetting और disturbing से episodes होते हैं उसका एक थीम होता है जो कैरी ऑन करके इंसान चलता है. बिकॉज द पिक्चर दैट इज बीइंग सेट इन द माइंड, दैट्स व्हाट कंटिन्यूज द एंटायर टाइम. सो जो साइकोटिक डिसऑर्डर होता है उसमें हम ये कहते हैं कि पर्सन जो है वो एक्सपीरियंस क्या करता है, द पर्सन जस्ट कंप्लीटली लूज द टच विद द रियलिटी. दैट्स व्हाट इज द मेजर थिंग दैट एनीवन हैज टू अंडरस्टैंड. So when you feel that you're losing touch with the reality, real life नहीं आप देख पा रहे, but there is something inside your mind which is somewhat you think is the reality, which is not the reality. So that's when you're anyone who is experiencing this thing, then they are going or experiencing psychotic depression. So ये major depressive disorder कहा जाता है with psychotic features. इसमें कुछ psychotic features भी रहते हैं जैसे कि मैंने बताया कि hallucinations and delusions. So इसमें individuals sometimes suffer करता है and actually most of the time suffer करता है combination of symptoms से, depression के भी और psychosis से के भी. That is how I said it is psychotic depression. So there is depression for sure. The person is feeling sad, person is feeling totally losing touch with the reality or don't feel any interest in doing day-to-day routine tasks and उसको किसी भी चीज में interest नहीं है. Along with that, there are certain things, symptoms जो कि psychotic symptoms हैं, delusions और hallucinations आते हैं. So psychosis जो एक है मैंने बताया mental state है जो कि delusion और hallucination से mark की हुई है and sometimes इसमें combination of both होता है. Few people of psychotic cases experience hallucinations only and few people experience only the delusions, but there are few who experience the combination of both as well as there's a depression too. So this is psychotic depression and it is a serious type of depression. Never take it very lightly. So when anyone or any of your loved one is experiencing these things, so definitely make sure to seek help. Moving on to the last type of the depression category, the first type of mood disorder, the last category is depression, which is related to medical condition, either the medication or the substance abuse. So this does happen when mood swings happens. The reason is when a person, जब एक person को medical condition है या वो lot of medication पे है या फिर substance abuse कर रहा है. So that is what is the another reason of mood swing in the person, or mood disorder in the person. So now the first type of mood disorder has been explained. Moving on to the second type, which is bipolar disorder. So this is something again you have to understand in a very good way. So when I'm talking about bipolar, which means maniac depressive disorder. Maniac is something when somebody has the obsession of something, or a love towards something, a craze, a desire towards something in an unhealthy way, right? The person found or find out to be a very, you know, having an obsession towards something. So bipolar disorder जो है वो swings in mood आते हैं इसमें, इससे define किया जाता है. और इसमें period of depression जो है वो mania से period of depression to mania, to that extreme चला जाता है उसका depression की, that the person becomes either obsessed of something, either he or she starts to love something so badly, madly, or the person has a great craze or desire towards something in a mad way, right? So when someone experiencing low mood symptoms, low mood, then symptoms may resemble to those of clinical depression. जब low mood कोई experience कर रहा है, तो symptoms किसके साथ match करते हैं? Clinical depression. So basically, clinical depression is when somebody has been diagnosed with feeling very low. There's a lot of sadness. जब आपको बहुत ऐसा feel हो रहा है कि you just are in bed and not coming out of bed, and there's a darkness you prefer all around you. So that's when the person is being diagnosed with a clinical depression. But bipolar में हम क्या कहते हैं कि extreme mood swings होते हैं, but इसमें maniac episodes होते हैं. और now depressive episodes जो है वो alternate होते हैं with maniac, either maniac or you can say mania. So during maniac episodes, person feel करता है extremely elated, or you can say extremely high, और उसको इतना extreme irritability होता है, या फिर उसका जो activity का level होता है that is being increased. So if you have any, by chance, anybody, if you have encountered, seen that somebody is doing their work very restlessly, कुछ लोग ऐसा काम कर, कुछ अपना काम कर रहे हैं, let's say office work कर रहे हैं, or they are busy doing something, but they are abruptly doing so faster, और उनका जो उस पर कंट्रोल नहीं बन रहा, जो भी एक्टिविटी वो कर रहे हैं. लेट्स से वो अगर ड्राइविंग कर रहे हैं तो बहुत रेकलेस ड्राइविंग होगी, वो कुछ अगर फूड चॉपिंग कर रहे हैं, सो दैट इज लाइक टू फास्ट दैट यू कैन थिंक दैट इट इज इवन नॉर्मल एट ऑल. और इफ एनी ऑफ द एक्टिविटी वॉट एवर दे आर डूइंग, जब आप देखेंगे कि कोई इंसान अपनी एक्टिविटीज में बहुत ही ज्यादा एक वियर्ड सा बिहेवियर शो कर रहा है, कि वो एक्टिविटी को इतना फास्ट कर रहा है विच इज इम्पॉसिबल इन फॉर अ नॉर्मल मैन टू बी डूइंग, राइट? So जब ऐसे एपिसोड होते हैं, which means there is maniac involved. So bipolar disorder के 4 categories हैं, 4 types हैं, which I'm going to tell you one by one. So talking about the bipolar 1 ही है जो most severe है. बाकी के जो इसके parts या types में describe करूंगी वो इतने severe नहीं है, but it is the thing that still you can't ignore all of these, right? So जो bipolar 1 है वो सिवियर क्यों है? क्योंकि इसमें मैनियाक एपिसोड्स होते हैं जो लास्ट करते हैं 7 days तक. That if somebody is experiencing all the maniac thing, let's say obsession, love, desire, craze for anything, so that is to an extreme level कि जो वो कंट्रोल भी नहीं कर पाता है, और इसलिए sometimes उसको कंट्रोल नहीं होता है तो हॉस्पिटलाइजेशन करनी पड़ती है ऐसे पर्सन की, just to control the symptoms, just to stabilize the mood swing of that person. So when the person is calmed down, that's when he or she can do the daily routine tasks. So it is that type of a severe case. I mean, the bipolar 1 is a very severe type in which sometimes hospitalization is required. So do not take it lightly. So depressive episodes जो हैं वो occur होते हैं often, और वो last करते हैं 2 weeks तक, right? And sometimes जो symptoms हैं, both mania and depression, are present at the same time. Sometimes in the bipolar type of mood disorder, what you will see that the symptoms of depression are there, also the symptoms of mania are there. So both of these symptoms you will see in bipolar 1, both all together. So now I'll be explaining the bipolar 2 type. So when I'm talking about the bipolar 2 disorder, वो bipolar 1 से less severe है. इसमें भी साइकिल्स ऑफ डिप्रेशन होते हैं, बट जो पर्सन है विद दिस इलनेस ऑल्सो एक्सपीरियंस हाइपोमेनिया. सो ना हाइपोमेनिया जो है उसमें भी मेनिया एपिसोड्स होते हैं. सिमिलरली एज आई एक्सप्लेन्ड, ऑब्सेशन इज देयर, लव इज देयर, डिजायर इज देयर, क्रेज इज देयर, बट उतना हाई लेवल और डिग्री का नहीं होता है जितना बाइपोलर 1 में होता है. हाइपोमेनिया पीरियड जो है वो इतने इंटेंस या इतने डिस्ट्रप्टिव नहीं होते हैं कि पर्सन जैसा मेनियक एपिसोड्स में एक्सपीरियंस करता है. सो बाइपोलर 2 जो है यूजुअली हैंडल हो जाता है, और जिसको भी बाइपोलर 2 होता है वो अपने डे टू डे और रूटीन लाइफ की जो एक्टिविटीज है वो इजीली परफॉर्म कर सकता है, उसमें इतना प्रॉब्लम नहीं आता है. एंड इसमें हॉस्पिटलाइजेशन की भी जरूरत नहीं होती है, बट डेफिनेटली treatment would be required. Fine. And moving on to the third type, this is cyclothymia. So cyclothymia disorder, ये भी एक बाइपोलर डिसऑर्डर का पार्ट है जो कि डिफाइन किया है माइल्डर फॉर्म ऑफ बाइपोलर. इट इज अ माइल्डर फॉर्म ऑफ बाइपोलर, राइट. इट इज नॉट दैट इंटेंस और सिवियर जिसमें हॉस्पिटलाइजेशन की जरूरत हो. ये लेस सिवियर है, राइट, बट ये माइल्डर बाइपोलर है, बट स्टिल इट ऑल्सो नीड प्रोफेशनल्स अटेंशन. पीपल जो हैं साइक्लोथीमिया से एक्सपीरियंस क्या करते हैं, कॉन्टिन्यूस मूड स्विंग्स, either on a very high side or either on a very low side, or there are mild to moderate kind of switches, you can say कि उनको mild से moderate level of mood swings होते हैं. सो इतने इरेगुलर होते हैं कि समटाइम्स इमोशनल स्टेट जो है उनका वो एक्सट्रीमली हाई हो जाता है, माइल्ड टू मॉडरेट, और एक्सट्रीमली लो भी हो जाता है, अगेन माइल्ड टू मॉडरेट. एक्सटेंडेड पीरियड ऑफ टाइम ऐसा चलता रहता है. और इन एडिशन इसमें क्या होता है कि मूड जो है क्विकली चेंज हो जाता है एनी टाइम व्हेन यू आर इंटरैक्टिंग विद समबडी जिसको ये प्रॉब्लम होगा साइक्लोथीमिया का. उनके मूड स्विंग्स इतने क्विकली होंगे कि व्हेन यू आर टॉकिंग टू द पर्सन आप भी एकदम से हैरान हो जाएंगे कि अभी द पर्सन इज behaving this way, and suddenly ऐसा क्या हुआ, this person is not really in a good mood, right? So the mood swings are there that switch from mild to moderate very very quickly. So there are only short periods of normal mood, और वो लोग नॉर्मल जो है बहुत ही कम ड्यूरेशन के लिए रहते हैं. एडल्ट जो होता है वो 2 years तक ऐसे मूड स्विंग्स में रहता है, दैट्स व्हेन इट इज बीन डायग्नोस्ड. और बच्चों में ये 1 year तक रहता है, बच्चों और एडोलेसेंस में. सो दैट्स व्हेन वी कैन डायग्नोस समबडी इज एक्सपीरियंसिंग साइक्लोथीमिया, राइट. सो सिम्टम्स डेफिनेटली परसिस्ट होते हैं 2 years का एडल्ट, 2 years के लिए एडल्ट में, और एडोलेसेंट्स एंड चिल्ड्रन में for 1 year. So this is the another form. And moving on to the last category of mood disorder. So now talking about the third type of mood disorder, which is other mood disorders, जो कि मतलब कि जिनको हमने like find out किया है कि that this is also being categorized as mood disorder. So other categories या types क्या हैं? One is pre-menstrual dysphoric disorder, that is also being described in one of my DD, but I would like to explain here again. So this type of mood disorder जो है ये भी एक women disorder है, pre-menstrual, which means कि menstruation और periods से before, and it just get better after the periods are over. ठीक है. So ये जो mood disorder है वो occur होता है 7 to 10 days before the period of a woman. ठीक है. And goes away within the few days of the start of the menstruation time. जैसे ही onset हो जाता है menstruation या periods का women में, उसके बाद it gets settled. Until that time period, the women experience a lot of mood swings. और ये जो disorder है, again it is because of the hormonal shifts in the body. This is not in control of the women, and this does happen because of the hormonal shift. और जो symptoms हैं उसमें again irritability होती है, lot of anger, the women experience a lot of tension days, right, or decreased interest in usual activities that she happily does otherwise, और sleep भी disturbed हो जाती है, right. So ये एक women disorder है जो कि definitely it happens before the menstruation of the women starts, and थोड़े जैसे ही menstruation start हो जाता है उसके बाद it stops, or it gets settled down. So I told you the symptoms of this. Moving on to the another type of other mood disorder, that is intermittent explosive disorder. So now when I'm talking about intermittent explosive, which is continuous but explosive, right? There is something जो कि जिसको हम unwarranted anger भी कहते हैं, और flying into a rage of no reason ये भी कहते हैं. Why? So explosive word इसमें लिखा हुआ है, so which is the another type of disorder. इसमें क्या होता है कि suddenly you will see that the person is too much aggressive unnecessarily, you will feel, or जैसे कि there's a rage in the person for no reason. The person is standing with you, but suddenly you will see a lot of change in the person, and you will experience that why the person is being really so hyper, right? Just 1 second. Okay, so when somebody is experiencing this kind of disorder, which is intermittent explosive disorder, तो उसमें behavioral outbursts burst होते हैं. तो होता क्या है, पर्सन का जो बिहेवियर है वो एकदम सडन चेंज देखोगे, एंड यू विल सी अ आउटबर्स्ट इन देयर बिहेवियर, और वो इतने आउट ऑफ प्रोपोर्शन होंगे कि उनका एग्रेशन एक एक्सट्रीम लेवल में होगा, दैट यू विल आल्सो गेट शॉक दैट व्हाई इंसान ऐसा क्यों कर रहा है, इतना एक्सप्लोसिव एंगर, व्हाट इज द रीजन बिहाइंड. So when somebody has no control in their anger, so definitely this would be one of the disorder which the person might be experiencing, right? So it is the third type of mood disorder, right, which comes into the category of other mood disorder. So with this, we have ended up the types, moving on to the symptoms. And as I told you that the mood disorder is being divided into two types. One is depression, another is bipolar. And the other third one is other type of mood disorder. This all will be covered into these symptoms. So I'm going to talk about the major depressive, which is the first type of mood disorder. सो उसके सिम्टम्स ये हैं कि पर्सन यूजुअली फील करता है सैड मोस्ट ऑफ द टाइम और नियरली एवरी डे. ठीक है, व्हेन समबडी इज एक्सपीरियंसिंग दिस, कि उसको बिल्कुल सैडनेस ही है लाइफ में और हर दिन ऐसा वो फील कर रहा है सैड, देन द पर्सन नीड्स सम हेल्प. And lack of energy or feeling sluggish when a person is experiencing that there is no energy और वो उसको बिल्कुल lazy feel हो रहा है for the constant number of days, and मतलब it's like for a longer time period you're into this kind of a feeling, right? So that's when is a symptom of major depression. And the third one is feeling worthless or hopeless. When जब कोई ऐसा experience करता है कि like I'm worthless, I'm hopeless, or there's nothing to do. So this is another symptom you can find out or understand that person is experiencing depression. Gaining weight or losing weight. This is also the one major sign. Why? Because either the person, when the person starts to gain weight, एकदम suddenly weight में changes आ रहे हैं, या वो बढ़ रहा है या वो घट रहा है. So which means it is a sign that the person is experiencing something which is major depression and which is not so normal. And loss of interest सभी एक्टिविटीज में जो नॉर्मली इंजॉयमेंट भी देते थे पर्सन को, बट नाउ द पर्सन इजंट रियली फीलिंग और रियली एक्सपीरियंसिंग एनी हैप्पीनेस इन डूइंग दैट. सो देयर इज नो जॉय, राइट? सो हर एक चीज में से इंटरेस्ट भी हट गया है इंसान को. सो दिस इज अ सिम्टम ऑफ मेजर डिप्रेशन. अनदर इज या इंसान बहुत ज्यादा सो रहा है या बहुत कम सो रहा है, नींद या तो बहुत आ रही है या आ ही नहीं रही है, तो दिस इज ऑल्सो अ सिम्टम, राइट? And frequent thoughts about death and suicide when somebody is experiencing depression. So ये एक major type of symptom होता है जिसमें कि उसको एक ऐसे negative thoughts आते हैं जिसमें either the person thinks of committing suicide, or there are certain thoughts in the mind about death. So when this is happening with any of your loved one, make sure to give them or provide them a right environment so that we can fix this thing. Do not leave that person alone for a longer time. डिफिकल्टी कॉन्सेंट्रेटिंग और फोकसिंग. सो जब डिप्रेशन, मेजर डिप्रेशन से कोई गुजर रहा है तो उनको डिफिकल्टी बहुत ज़्यादा आती है कॉन्सेंट्रेट करने में किसी भी चीज़ को या फोकस करने में, राइट? सो दीज आर द सिम्टम्स ऑफ type 1 of mood disorder, that is depression. Moving on to the another type of mood disorder, which another symptoms are of bipolar disorder, which includes both depression and mania, and symptoms of hypomaniac, maniac episodes. Everything is being covered in here, right? So bipolar disorder, in total, the symptoms are feeling extremely energized or elated, right? या तो वो पर्सन फील करता है कि उसमें इतनी एनर्जी है, द पर्सन स्टार्ट्स टू फील बहुत ज्यादा हाई, राइट? इतना रैपिड स्पीच मोमेंट हो जाता है, दे स्टार्ट टू स्पीक सो फास्ट कि आपको वो लगेगा इट्स नॉट नॉर्मल हाउ अ पर्सन इज टॉकिंग और स्पीकिंग लाइक दिस, ठीक है? सो विच इज नॉट नॉर्मल, राइट? एंड एनीथिंग विच इज नॉट नॉर्मल इज एब्सोल्युटली ऑब्जर्वेबल, राइट? यू कैन सी, आपको इमीडिएटली पता चल जाएगा. So another symptom is agitation, restlessness. So the another symptom of bipolar type of a mood disorder is बहुत सारा गुस्सा आना, अग्रेशन आना, रेस्टलेसनेस होना, इरिटेबिलिटी फील होना. अनदर इज रिस्क टेकिंग बिहेवियर बढ़ जाना, जैसे कि बहुत सारा मनी स्पेंड करना या ड्राइव करना recklessly, which I told you initially as well. So this is another type, right? Another kind of symptoms that is being seen in the people who are experiencing mood disorder, right? सो अनयूजुअल इंक्रीज इन एक्टिविटी, जब भी कुछ भी काम कर रहे हैं उसमें एकदम से इंक्रीज ऑफ एक्टिविटी बढ़ जाना, राइट? या तो बहुत सारे काम एक साथ में करना, या फिर यू नो जो भी एक्टिविटी कर रहे हैं वो इतने इंटेंसली करना, विच इज अगेन अ सिम्टम. रेसिंग चेजिंग थॉट्स होना, जब आपको यू आर नॉट इन कंट्रोल ऑफ योर थॉट्स, यू कैन बैलेंस व्हाट यू आर थिंकिंग, और वो बहुत ज्यादा थॉट्स जो है वो इंक्रीज हो जाते हैं. दिस इज ऑल्सो अ सिम्टम. इंसोमिया या ट्रबल हो रहा है, आपको स्लीपिंग इश्यूज आ रहे हैं, ठीक है? जब आप सो नहीं पा रहे हैं, और व्हेन यू आर एक्सपीरियंसिंग देयर इज नॉट अ प्रॉपर साउंड स्लीप यू आर हैविंग. ऑल्सो देयर आर एपिसोड्स जब आपको नींद आ ही नहीं पा रही है, राइट? या बहुत ही मुश्किल से 1 घंटे की नींद आ रही है. इट्स नॉट अ साउंड स्लीप ऑफ 7 to 8 hours, विच इज मिनिमम रिक्वायरमेंट ऑफ एवरी ह्यूमन, राइट? सो जब ऐसा सिम्टम्स हैं, आपकी नींद भी उड़ गई है, विच इज ऑल्सो अ साइन. फीलिंग जंपी और ऑन द एज ऑफ नो apparent रीजन, फॉर नो apparent रीजन, जब आप ऐसा फील कर रहे हैं कि देयर इज अ लॉट ऑफ यू आर ऑन द एज ऑफ समथिंग, कुछ है जो आपको बहुत सता रहा है, आप एक बिल्कुल एक्सट्रीम एज में पहुंच गए दैट यू कांट इवन कंट्रोल और हैंडल. तो कोई उसका उस बात का कोई रीजन भी नहीं है. व्हेन ऐसा सिम्टम है आप में, तो दिस इज ऑल्सो अ साइन ऑफ मूड डिसऑर्डर. फाइन. So I'm through with the types of mood disorder. I hope I have given my best to explain everything. So now you have the understanding of all the mood depression, mood disorder, right? And here on my screen are my official profiles of good mental health. You can take a screenshot and get in touch with me. Now, moving on to be discussing the case, right? So I'll discuss the case. So the case basically, this is on mood disorder, which the person was 43 years old, who just reached out to me, and basically the wife and husband both came to me, and the husband was experiencing the mood disorder. Okay, so he was 43 years of age, and when the wife reached out to me, she started explaining that my husband is experiencing persistent depressive disorder. So I was quite surprised that she knows that the depression type. So I asked her that how do you know about the person your husband is experiencing persistent depressive disorder, or you have heard of this thing before. So she said no, he's been diagnosed, and he was into certain medication by that doctor, but just for a few number of days he just continued with the medication. He was not feeling like to have medication for what trouble he's experiencing. So he himself just discarded the treatment, the whole intervention. He just thought and planned by himself that he don't want to continue. तो उन्होंने वो अपना मेडिकेशन लेना छोड़ दिया, और like he just was not agreed to take any medication, also no treatments he wanted. He was experiencing a lot of things. और persistent depressive disorder को मैं explain दोबारा से करती हूँ कि जो persistently होता है last like इसका longer time period होता है 2 years तक depression में रहना इंसान का, और dysthymia भी कहते हैं इसको, राइट? जब पर्सन इसको एक्सपीरियंस करता है, इट्स नॉट इजी. देर आर सर्टन टाइम पीरियड जिसमें वो नॉर्मल भी फील करता है, but it doesn't mean maybe for a month or and a half month and half, also for maybe for 2 months also the person can feel extremely normal, right? But it doesn't mean that the person is absolutely right, all right after that. इट्स जस्ट persistent. दैट इज वाई मे बी अभी हुआ है, एक सर्टन फेज आता है जिसमें इंसान सोचता है कि आई एम एब्सोल्युटली फाइन, बट वो दोबारा से ऑकर होता है, रीऑकर होता है. So I don't know for what reason the person wasn't enough happy to take the treatment carry forward. उन्होंने medication stop कर दिया and this impacted him still, and that is when the problem was increasing more and more. They reached out to me, and when I started taking the case history, I got to know that he's not only experiencing persistent depressive disorder, he was experiencing seasonal affective disorder too. और मे बी वेन ही वेंट टू दैट डॉक्टर, उस टाइम पे एक ही डिसऑर्डर था उन्हें, बट जब उन्होंने मेडिकेशन भी नहीं ली, ट्रीटमेंट भी नहीं लिया, दैट्स व्हेन इट माइट हैव इंक्रीज. सो सीजनल डिप्रेसिव डिसऑर्डर को मैं दोबारा, सीजनल इफेक्टिव डिसऑर्डर को मैं एक बार फिर से आपको रिकॉल करवाऊंगी, जो कि सीजनली इम्पैक्ट होता है किसी भी पर्सन को, राइट. सो एट दिस पॉइंट ऑफ टाइम क्या हुआ था कि उनको ये भी सिम्टम्स थे, द थिंग्स दैट ही एक्सप्लेन ड्यूरिंग द सेशंस, एवरीथिंग, द केस हिस्ट्री वाज बीइंग मेड, and that's when I was able to make this diagnosis that unko seasonal affective disorder bhi hai, because for a certain time period he feel all right, but seasonally and especially on the winter season he used to feel very depressive, और उस टाइम पे वो किसी से बात भी नहीं करना चाहते थे and extremely अपने आप को अकेला रहना प्रेफर करते थे. So when I explained this to his wife, so she was able to connect with this, that it is true that at this season he go totally out of zone, and he's like he doesn't want to get in touch with anyone. So any which ways, so when the diagnosis was being made, I started with the intervention, the couple of sessions, not, I won't say just the couple of sessions, the sessions were continued for couple of months. That's when he got the relief, and he was really in his balance, and he was able to feel better, and he himself said this, that he's absolutely doing good now. But I won't say that symptoms were absolutely or 100% gone. So in I can say that 2.5 months time period he was feeling better. He started to get the control of his life back, and he started to live happily. And that's when the treatment is still continued, and he's doing a lot of lifestyle changes as well. So जब हम कुछ advice देते हैं that it's not only just the medication, not just the treatment, there are certain things जो एक person को अपने end से भी करनी है. So we as therapists, when we recommend certain things, that is also necessary for the patient to follow, right? So I am a psychologist. I am not allowed. I'm not into medication. I don't prescribe any medication, but definitely the treatment. My treatment was therapeutic sessions, right? So now moving on to the treatment part. So let me discuss with you the intervention, right? So again, I am going to tell you that any disorder, so the basic foundational approach, how a therapist starts or a psychologist would go about it. The basic foundational approach is starting with the case history. The case intake is there. We start with the case intake, and that is being followed by the counseling session. So when the case intake is done, that's when a therapist or a counselor or a psychologist is able to understand what the problem is, which are the problematic areas, and what is the strength of the person, or somewhere in the case history we are able to connect with what is the trouble. And it is followed by the counseling session, because counseling session help us to build a rapport with the patient. It helps us to get more and more in-depth knowledge and understanding about the problem. And that's when the next stage comes, wherein when we have collected the desired information that we needed, so this is now the time for doing a psychological assessment. So now, why to do the psychological assessment? Because during this counseling and case intake time, the therapist is able to understand that what is the problem. And now when you have understood that what is the problem, but you don't know the intensity of the problem, so assessment is a correct way to measure the problem, right? This is one thing. And when the assessment is done, that's when we can a professional is able to make the professional diagnosis. So once the diagnosis is being made, that is now followed by the intervention, and that's when you can start with the intervention. So intervention is always a lot of things, including not just the therapeutic rounds. There are psychotherapeutic sessions, which can be a talk therapy, other form of multi approach form. You can say a lot of therapeutic sessions can be involved depending upon what a counselor or the psychologist feel is best, or therapist can work upon the person in some way or the other way to seek results in the person. And now when we are talking about mood disorder, so it is important for everyone to understand that how any therapist will start will be through a talk therapy session. That is, there is a talk session, okay, that is a psychotherapeutic session in which there will be a talk involved, and definitely through this psychotherapeutic session the therapist will find out the, you can say, a negative thought pattern, or what is there to be that needs to be fixed in the person when there's a lot of mood swings in the person when we are talking about mood disorder. So let's find out that what is the issue, right? Why there is a lot of mood swings. So it is important to understand, fix through the psychotherapeutic session, which is followed by the problem solving technique, and the therapist tries to solve the problem, which whatever is the whatever is the area which needs to be focused, and where the patient needs some, some kind of a solution. So this approach is also used, which is being followed by the CBT, which is cognitive behavioral therapy, where it is only, I'm talking about mood disorder, because जब mood disorder है तो definitely there are certain distorted, dysfunctional, or you can say some negative thought pattern are there that need to be switched with the positive thought pattern, right? So it is important for the client or the patient to understand this thing. It is important, right? So in CBT, so in CBT, the therapist helps the client, the patient, to understand which are the negative patterns they have, and they both work together. The therapist make the patient aware of what are the negative or the unuseful thoughts the person is carrying. So when they are aware of it, they get ready to get it fixed, and or you can say to change those thought patterns and switch it with the positive thought patterns. And also the another type of therapy which I use is EFT, because here in the case of hallucinations, right, and sorry, in the case of hallucinations, delusions also, when there was when the person is, what do you say, the another bipolar type जिसमें कि uh, okay, so what it was, okay, so when hallucinations or when the person is experiencing limiting beliefs, right? So जब उसको thought pattern ऐसा है कि there are certain beliefs that has been fixed into the mind of the person, which is not even there, right? But the person has made a mindset that this is the reality, this is what is correct. So EFT is the therapy which is called emotional freedom technique, which wonderfully and powerfully work upon these things. When somebody has made their limiting belief about something which is not even the reality, but that has something जो इंसान ने अपने अंदर माइंड में सोच लिया कि यही रियलिटी है, जबकि वो रियलिटी नहीं है, वो इसका एक लिमिटिंग बिलीफ बन गया. तो जब ऐसे लिमिटिंग बिलीफ्स इंसान के माइंड में फिक्स हो जाते हैं, दैट कॉजेज अ लॉट ऑफ अदर इमोशनल हेल्थ प्रॉब्लम्स इनटू द पर्सन, लाइक बहुत ज़्यादा रेस्टलेसनेस फील होना, रेकलेसनेस फील होना, there's anxiety in the person, sadness in the person, when you're feeling depressive, when you're having maniac episodes, when you have things like a lot of other emotional health concern also. So जब mood disorder की हम बात कर रहे हैं, so उसमें बहुत सारे multiple things, एक emotional situations एक person experience करता है. To control that, EFT is the wonderful technique and a wonderful therapy that can give great results to the person. Not only that, moving on to the another therapeutic session and therapeutic type, which is light therapy. So light therapy, you must be thinking that what it is. So let me explain that. इसमें क्या है कि एक थेरेपिस्ट जो है एक लाइट थेरेपी के फॉर्म में एक पर्सन को एक लाइट थेरेपी इंट्रोड्यूस करता है, जिसमें कि एक नॉर्मल जो सनलाइट है उससे भी 20 टाइम्स एक्सट्रीमली हाई लाइट के साथ उस पर्सन को एक्सपोज किया जाता है. वाई टू डू दिस? इट इज जस्ट बिकॉज टू रिड्यूस द एपिसोड्स ऑफ देयर सैडनेस, देयर डिप्रेशन दैट कॉजेज मूड डिसऑर्डर इन द पर्सन. जैसे कि सीजनल अफेक्टिव डिसऑर्डर जो है वो स्पेशली इससे ट्रीट किया जा सकता है एंड किया जाता है. बिकॉज इसमें क्या है, जब वो सीजन, पर्टिकुलर सीजन जो इम्पैक्ट करता है एक पर्सन को, विच इज नॉट, द पर्सन फील वेरी डिप्रेसिव एट दैट टाइम, उस डिप्रेशन से वो इजिली बाहर नहीं आ सकता है. So when the person is exposed to this light therapy treatment, जिसमें कि 20 times higher intensity में light होती है और उसको approximately 20 to 60 minutes तक के लिए expose किया जाता है उस client को, उस patient को, तो उसमें आप extreme change देखेंगे. So this therapy works wonderfully, and it is also equally important with all the other therapies. I won't say that this is the only therapy to fix the mood disorder, but it is part of one of the therapy that a therapist decides to give, and depending upon which time the therapist decides, right? And moreover, not only this, the breathing technique and the meditation is also a wonderful technique. So breathing is important when somebody is experiencing mood disorder. So the person is experiencing a lot of highs and lows that I mentioned. Extremely, there is a moderate, mild to moderate swings जब हो जाते हैं, या a person starts to feel extremely out of balance, lose the touch with the reality. So उस point of time पे क्या है कि person normal नहीं feel कर रहा है. So उस टाइम पे उसको ये ब्रीदिंग एक्सरसाइज करवाई जाती है, जिससे कि he or she can get the calm back and start to feel really balanced and settled with their mind extremely at that point of time. सो ब्रीदिंग एक्सरसाइज क्यों करवाई जाती है कि स्टेट ऑफ माइंड जो है उसको बैलेंस किया जाए. एनीथिंग दैट इज आउट ऑफ कंट्रोल, विच इज नॉट इन टू योर कंट्रोल, दैट नीड्स टू बी इन योर हैंड. सो आपको आपका कंट्रोल वापस दिलाने के लिए ये ब्रीदिंग एक्सरसाइज करवाई जाती है. समटाइम्स व्हेन वी टेल द पेशेंट टू डू दिस, वो अपने आप से कभी नहीं कर पाते. So that is why during the therapeutic session, while continuing all the other multiple therapies, सो बीच में एक टाइम स्पॉट में ये ब्रीदिंग एक्सरसाइज भी कंटिन्यू की जाती है, सो दैट द पर्सन कैन स्टार्ट टू फील रियली गुड. एंड ब्रीदिंग से उसको एक कामनेस भी मिलती है, एक माइंड का कंट्रोल वापस आता है, एंड बैलेंस फील करता है पर्सन, एंड द पर्सन बिकम्स मोर बेटर टू टेक एनी डिसीजंस, और उसका फोकस गुड हो जाता है, उसकी कॉन्सेंट्रेशन गुड हो जाती है, उसकी कॉग्निशन थोड़ा सा बेटर हो जाता है, राइट? So it is a kind of therapy which has to be done repeatedly. It's not just आपने एक बार 10 minutes का या 15 minutes का session कर दिया, it's done. That has to be on a regular note so that you can seek a major difference into your life. That has to be the part of your routine in otherwise as well, even if you're completely mentally sound. So if you will continue doing the breathing exercise, you can get the calmness. And not only this, sometimes in the severe cases, so antidepressants, mood stabilizers, and antipsychotic medications are also introduced. Only a medical practitioner can involve all of these medications. If this case is not being handled, if there is a severity, a therapist feels that there is a severity in the case, so that's when we recommend the patient to a psychiatrist, because they are into the medicinal line and they are the medical practitioners. They are better person to prescribe medication to just stabilize the situation and stabilize the problem. And that's when the person feels better, and the therapeutic sessions are supposed to be continued along with the medication, right? So इससे person better feel कर सकता है और जल्दी जल्दी ठीक भी हो सकता है, right? So these are all the interventions which I mentioned. Not only that, uh, you know not only that, just the therapeutic sessions, sometimes medications are also involved. So now we are at the end of the session, and again I have switched on to the official profiles of Good Mental Health, which is on the screen. You can get in touch with me if you have any queries. You can just ask me, and if in case that you have something you don't want to come up right here, you can just write an email to me at info@goodmentalhealth.in. And at the end, I would repeat that I'm like starting up with the psychology internship program very soon. The batch is starting really soon. So do not wait for a longer time. Go on to www.goodmentalhealth.in So in that, when you go to my website, there will be a tab that you can find, which is of psychology internship. Click that, get the whole information that how you can enroll yourself. Also, you can have the detailed understanding of what all I'm going to cover. There are going to be a lot of rewards, there are going to be a lot of mock sessions, and you can upgrade your skills from just the study mode to a practical level, right? So here is a chance for you to avail this thing and become a professional in the field of psychology. So I'll welcome you definitely in my internship program. Many have availed this and have, by now many people have become professionals in their life as well. So they are doing well. So I would really be happy to make more professionals in this field. So which is a lovely field for me. So that is how by heart I do all of the things in the internship program. There's a lot that you will learn. So, with this beautiful note, I would like to say bye. And I have covered all the things. I hope you have had the great understanding, and not only just the queries regarding the mood disorder. If you have any queries relating to the psychology internship, you can directly message me on my social media platforms. Definitely, my team members can reply to you immediately and will help resolve your query. And if you want to enroll yourself, if you need some more guidance on that, we can definitely provide you with that guidance. So thank you for listening. I hope you had a great time listening to me, and I definitely had a great time explaining the entire episode of DD7, which was mood disorder. So it was with a very clear or a detailed insight. I'm sure that this is going to help many of you. So I'm surely going to come back in the next DD episode very soon. So until we will meet next time, have wonderfully blissful days and take care. And until we meet next time, Rabraka. So I'm ending the broadcast. Those who have just missed out anything, or definitely it is going to broadcast in all of my social media platforms. You can go watch in some time. It is going to be uploaded. So thank you for having your great time with me. So this side psychologist Anuradha saying bye. Take care. Okay, on the comment section, I can see Mr. Dhoni said hi. So we would like to say hi back to you. Have a blissful life. Take care. Bye bye.